Most nursing students don't struggle because the material is too hard. They struggle because they're taught to memorize topics instead of understanding concepts. And that's why every new lecture, exam, or clinical day can feel like you're starting over. These are topics. They're what you see in your syllabus and textbooks. They change every lecture, every exam, and every patient. A concept is a clinical idea that helps you organize information and make sense of what you're seeing. Instead of memorizing details, a concept helps you recognize patterns, identify risk, and decide what matters most in a situation. That's why the same concept can apply across many different topics. Let's look at the topic of heart failure as an example to show how memorization starts to fall apart. When students try to memorize heart failure as one disease, it feels overwhelming and incomplete. That's because heart failure isn't just one problem that you solve, it's multiple concepts happening at the same time. You're thinking about oxygenation, perfusion, and fluid balance. Depending on what cues you're seeing, one of those concepts may matter more than the others in the moment. Now, let's look at one specific concept to show how this works. We're going to look at oxygenation. This concept doesn't belong to one disease or one chapter. It shows up across many different topics, even though the details can look different. In pneumonia, you're thinking about oxygenation. In heart failure, you're thinking about oxygenation. After surgery or with pain medication, you got it, you're still thinking about oxygenation. The details change, but the way you're thinking stays the same. This is why thinking in concepts changes how nursing feels. When you understand the concept, new information doesn't feel random or disconnected. It fits into something you already understand. Instead of feeling like every lecture is a fresh start, you're using the same ideas to make sense of new content. From this point on, when something feels confusing or overwhelming, ask yourself one question. What concept is this actually about? You can use this question during lecture, while you're studying, or when you're stuck on an exam question. It helps you stop chasing details and start focusing on what matters. If this helped things click even a little, I want you to pause a moment and reflect. What topic has made nursing feel random or overwhelming to you in the past? Drop it in the comments. I bet you're not the only one thinking it. In the next video, we'll start looking at the core nursing concepts. So please subscribe and click the notification bell so you don't miss it.